he had a fierce determination to succeed. And after 1 year in English high school, he approached the dean of Harvard Dental School about matriculation. Now, he doesn't have a high school diploma or anything. And at that time, he didn't need one. But he had to pass an examination. And believe it or not, he was admitted. But during that summer, he went back to Worcester, worked in the wire mill, and he earned his tuition. And in October, he matriculated at the Harvard Dental School as a member of the class of 1905, a virtual miracle. When the Harvard Dental class of 1905 first met, one of his classmates, a Yankee, is saying, "It would take wiser men than we to pick out the man who a quarter of a century later would have deservedly outstripped his classmates. In fact, I doubt Kazanjian would have been selected among the first 10, handicapped as he was by unfamiliarity with the language and in the provincial New Englanders like being a foreigner." End of quote. At the end of the first year, he came back to the wire mill, worked again, and in June of 1905, he received the degree of Doctor of Dental Medicine. That impossible dream had come true 5 years earlier. He opened up his office in Boston at the corner of Boylston and Tremont Street. And he became a teacher almost immediately after graduating, with very, very little remuneration. But this teaching would span his whole professional life. Now, fractures of the jaws in those days were treated in the school clinic, not in a hospital. And most of those fractures were, this was before automobiles, was because of broken fights and drunken fights. And there was very little remuneration for this. And no one seemed to want to do this work except Varaztad Kazanjian. And he treated actually 400 of these fractured jaws in this clinic. And he changed the treatment procedure. Now, I don't want to go into the clinical part of it. And in 1912, he married Sophie Guindet, a native of Switzerland. Now, the largest conflict in the world yet erupted in 1914 and quickly embroiled Europe. Though it was rumored that the war would be over in 4 months, it lasted 4 prolonged and difficult years. The opposing armies were trapped below ground in muddy trenches along a virtually stationary line extending from Switzerland to the North Sea, and in colossal battles that ebbed and flowed. A generation of the flower of Europe's youth would be forever lost or maimed. Now, Sir William Osler, the most brilliant and influential teacher of his medicine of his day, suggested that American universities supply doctors and nurses to staff much-needed base hospitals to care for the casualties of the British Expeditionary Force, and Harvard assumed the first to do this. Known as the first Harvard unit, it was rapidly assembled in June 1915. There were provisions for 32 physicians, nurses, 75 nurses, and 3 dentists. And Varaztad Kazanjian was the chief of this department. Now, fought for the most part in trenches and close combat, World War I produced highly destructive, disfiguring wounds of the face and jaws. Impossible. Scarcely anyone was prepared to handle this avalanche of broken faces. And in June of 1915, about a year after the war had begun, the Harvard unit arrived in France. There they took over General Hospital number 22, which was one of a group of 5 hospitals located next to one another, all under tents. Now, the arrival of the Harvard unit relieved British doctors for other duties. However, the administrative functions remained with the Royal Army Medical Corps. And again, as far as these facial wounds and jaws were concerned, little was being done. They were returned to England, where even their specialized care was rare. There was one great doctor, Dr. Harold Gillies, who did marvelous work, but he was pretty much alone. And you know what? In desperation, sculptors made masks of tin or copper to virtually cover these horrendous mutilated jaws, and they made eyes and mustaches to cover them. Something like the contemporary musical Phantom of the Opera, where you see something. And these mutilated soldiers formed an organization of mutual aid called the Broken Faces. As he had done once before in treating patients with jaw fractures, Dr. Kazanjian took upon himself the mantle of concern for the untreated and disfigured. He extended himself because he later said nobody knew what to do with them. And from these inauspicious beginnings, the first British facial treatment center in France was established by lieutenant and later major. Now he's in the British Army, so he's an officer. And he was only supposed to stay 3 months. The Harvard unit went back. But the British insisted that he stay, as did the 6 senior surgeons of the Harvard unit. If Kazanjian stays, it was said, countless men can be saved from mutilation and even death. He was even permitted to bring his wife, which is unheard of in a battle area. And the word of his unique skill spread along the battlefront, and he became the best-known surgeon of the Allies' armies before the war was over. He personally treated over 2,500 soldiers with gunshot and facial wounds. And his superior officer was Colonel Carr. He just said, give that man anything he wants. And the British established a hospital for him with 100 beds, and this was his permanent home until 1919. Yet, throughout it all, this Harvard dentist retained a modest simplicity and unassuming manner that gained him instant and spontaneous popularity. The history of Harvard Dental School said of him, and I'm quoting, a short, black-haired, soft-spoken man with kindly eyes, he went quickly about his business and performed miracles upon the soldiers. His stature and appearance made him almost insignificant. Yet in his presence, one felt their vitality, a force, a genius, a keenness of perception that gave him extraordinary powers of accomplishment. It is small wonder that the stricken British soldier, suffering untold agonies from splintered jaws and mangled faces, believed it implicitly in his ability to help them, end of quote, which he did. But just with him, it was the treatment of the jaws. He first brought the jaws into alignment before he treated the external face. And this is what made a difference with him. Only later did he operate on the face. Now, the foundations of modern plastic surgery had been laid in the battlefield hospitals of France, and this immigrant American dentist was its architect. In the performance of his duties, he crossed into a no man's land, which very few had done before, and he had formulated principles of treatment that were followed so successfully in World War I and even World War II. And he was mentioned in British War Office dispatches on 3 occasions, and it was at this juncture that a British writer described him the miracle man of the Western Front.